What if I told you that right now, as you're watching this video, there's a 93% chance that someone you love, maybe your parent, grandparent, or even yourself, will face at least one serious health challenge after age 65? And here's the really shocking part. Nearly 8 out of 10 seniors are juggling 2 or more chronic conditions at the same time. But before you feel overwhelmed, here's what the medical community doesn't always tell you. Many of these conditions are preventable, manageable, and in some cases, even reversible, with the right knowledge and action plan. Today, we're going to uncover the top 10 chronic conditions that affect older adults. But more importantly, I'm going to share practical, science-backed strategies that can help you or your loved ones live healthier, longer, and with more vitality than ever before. Let's start with some eye-opening facts. According to the latest research from the CDC, aging isn't just about getting a few more wrinkles or gray hairs. It's about facing a perfect storm of health challenges that can drastically impact quality of life. Think of your body like a well-maintained car. For the first 65 years, regular maintenance keeps everything running smoothly. But as mileage increases, different systems start showing wear. The engine, your heart, the fuel system, your metabolism, the joints and suspension, your bones and muscles. Just like a car, preventive maintenance and early intervention can keep you running smoothly for many more miles. The conditions we're about to discuss aren't inevitable sentences. They're challenges with solutions. Each one represents an opportunity to take control of your health destiny. 1. High blood pressure. The silent killer. 61% of seniors. High blood pressure affects 6 out of 10 older adults, earning its nickname as the silent killer, because you can have it for years without knowing it. Imagine your circulatory system like a garden hose. When the water pressure is too high, it damages the hose over time, eventually causing leaks or bursts. What you can do today: check your blood pressure regularly. Even drugstore machines work well for monitoring. Lose just 10 pounds to see significant improvement. Take a 30-minute walk daily. Your arteries will thank you. Cut back on salt gradually. Your taste buds will adapt in about 2 weeks. Practice deep breathing for 5 minutes daily to naturally lower stress and pressure. 2. High cholesterol. The artery clogger. 55% of seniors. More than half of older adults have high cholesterol, which is like having sticky sludge coating the inside of your arteries. Over time, this buildup narrows the pathways your blood needs to travel. Your action plan: replace butter with olive oil. Small swaps, big results. Add a 15-minute walk after meals to help process fats. Choose oatmeal over sugary cereals. Fiber is your friend. Ask your doctor about cholesterol screening every 5 years or more if you're at risk. Arthritis, the joint hijacker. 51% of seniors. Arthritis affects half of all seniors, particularly women. Think of your joints like hinges on a door. Without proper lubrication and care, they become stiff, creaky, and painful. Movement is medicine. Exercise. 30 minutes, 5 times per week. Gentle is fine. Consistency is key. Try water aerobics. Your joints get movement without impact. Maintain healthy weight. Every pound lost removes 4 pounds of pressure from your knees. Heat therapy in the morning. Ice therapy after activity. 4. Obesity. The condition multiplier. 30% of seniors. Obesity affects 30% of older adults and acts like a master key that unlocks the door to over 200 other chronic conditions. It's not about vanity, it's about vitality. Small changes, big impact. Understand Medicare coverage for obesity treatment. You have options. Focus on nutrient-dense foods rather than restrictive dieting. Start with 10-minute activity blocks. They add up. Seek support from healthcare providers who understand obesity as a medical condition. Let's make this practical. Here's a 30-day challenge that addresses multiple conditions simultaneously. Week 1, start with 10-minute daily walks and replace 1 sugary drink with water daily. Week 2, add 5 minutes of deep breathing or meditation and include 1 extra serving of vegetables daily. Week 3, increase walks to 20 minutes and schedule overdue health screenings. Week 4, connect with a friend or family member you haven't talked to recently and try 1 new healthy recipe. This isn't about perfection, it's about progress. Each small change creates ripple effects that can prevent or improve multiple conditions. Remember, you don't have to navigate this alone. The Chronic Disease Self-Management Program offers 6-week workshops that teach practical skills for managing chronic conditions. Contact your local area agency on aging to find programs in your community. Also, don't underestimate the power of family and friends. Share your health goals with loved ones. They can become your accountability partners and cheerleaders. Here's the empowering truth. While you can't control your age, family genetics, or gender, you have tremendous influence over lifestyle factors that affect these conditions. Every healthy choice you make is an investment in your future quality of life. The statistics we discussed today aren't unchangeable destinies. They're possibilities that you can influence. Whether you're 45 and planning ahead, 65 and taking action, or 85 and proving it's never too late, your health decisions matter and can make a real difference. Your health journey is personal and doesn't have to be overwhelming. Pick one small change from this video that feels manageable for you this week. Maybe it's a 5-minute walk if you're able, scheduling a checkup you've been postponing, or simply calling a friend. If this information was useful, please like this video and subscribe for more practical health content designed specifically for older adults. Your engagement helps us reach more people who need this information. Most importantly, talk with your doctor about your individual situation. Bring questions, discuss your concerns about costs or limitations, and work together to create a realistic plan. Many doctors are willing to work with patients on payment plans or can direct you to low-cost resources. Remember, you don't need to tackle everything at once. Small, consistent steps lead to meaningful improvements. You don't have to be perfect. You just have to start where you are with what you have. Take care of yourself. You deserve to feel your best. 5. Diabetes, the blood sugar roller coaster. 24% of seniors. 1 in 4 seniors has diabetes, a condition where your body struggles to manage blood sugar, like having a broken thermostat that can't regulate temperature. Your blood sugar toolkit: monitor carbohydrates, but don't eliminate them. Balance is key exercise for 30 minutes, 5 times weekly to improve insulin sensitivity. If pre-diabetic, losing just 5 to 7% of body weight can prevent progression. Work with your doctor to understand your target blood sugar ranges. 6. Cancer, the unwelcome visitor. 20% of seniors. Cancer affects 1 in 5 older adults, but early detection dramatically improves outcomes. Think of cancer screenings like smoke detectors, early warning systems that can save your life. Prevention is powerful. Never skip recommended screenings. They catch problems early when treatment is most effective. Wear sunscreen daily, even in winter. Maintain a healthy weight through balanced eating and regular movement. Limit alcohol and avoid tobacco in all forms. 7. Heart disease, the circulation crisis. 16% of seniors. Heart disease affects 16% of seniors when your heart can't adequately pump blood and oxygen throughout your body. Your heart is like the engine of your car. Proper fuel and maintenance keep it running smoothly. Heart-healthy habits. Get 7 to 8 hours of quality sleep. Your heart repairs itself during rest. Manage stress through meditation, hobbies, or time with loved ones. Choose heart-healthy fats, like those in fish, nuts, and avocados. Stay socially connected. Loneliness is as dangerous as smoking for heart health. 8. Depression, the mood thief. 15% of seniors. Depression affects 15% of seniors and is not a normal part of aging. It's like having a dark cloud that follows you around, but unlike weather, you can control this cloud. Mood-boosting strategies. Exercise releases natural feel-good chemicals. Even 10 minutes helps maintain social connections. Isolation feeds depression. Eat mood-supporting foods rich in omega-3s, like salmon and walnuts. Seek professional help. Depression is treatable, and you deserve to feel good. 9. COPD, the breathing challenge. 12% of seniors. COPD affects 12% of seniors, making breathing feel like trying to breathe through a straw. The good news? It's largely preventable and manageable. Breathing easier. Quit smoking. It's never too late to benefit. Avoid secondhand smoke and air pollutants. Get recommended vaccines to prevent lung infections. Stay active to maintain lung capacity. 10. Asthma, the airway constrictor. 9% of seniors. Asthma affects 9% of seniors and is often misdiagnosed because symptoms can mimic heart problems or COPD. Clear breathing strategies. Identify and avoid your triggers. they're different for everyone. Keep rescue medications accessible. Consider your environment. Air quality matters. Don't assume breathing problems are just aging. Here's what most people don't realize. These conditions often share common prevention strategies. It's like having a master key that unlocks protection against multiple health challenges. The big 5 prevention pillars. Move your body daily. You don't need to become a marathon runner. A 30-minute walk, swimming, or even dancing in your living room counts. Movement is medicine for almost every condition we've discussed. Fuel your body wisely. Think of food as fuel and medicine. Emphasize colorful vegetables, lean proteins, whole grains, and healthy fats. Limit processed foods, excess sugar, and sodium. Prioritize quality sleep. Your body repairs and regenerates during sleep. Aim for 7 to 8 hours nightly. Good sleep hygiene is like giving your body a daily reset button. Manage stress effectively. Chronic stress is like acid that corrodes your health from the inside. Find healthy coping mechanisms: meditation, hobbies, social connections, or professional counseling. Stay connected with healthcare. Regular checkups, screenings, and building relationships with healthcare providers who understand your goals are crucial. You're the CEO of your health. Make informed decisions.